common things people might experience after traumatic birth are what we call re-experiencing symptoms. So that's things like flashbacks, nightmares, intrusive memories, and often there's a real sense of nowness with those feelings. So although they're memories from the past, it feels like it's happening in the present day. Often people also experience a change in their beliefs about themselves, other people, about the world. After a traumatic experience like this, the world starts to feel less safe. You start to think that actually perhaps bad things can happen to you, and that can feel really destabilizing. And we know that all of this can also have an impact on bond with baby. So sometimes people might just feel a bit cut off from their baby. They might have lots of fears about the well-being of their baby. They might find it really difficult to engage in baby care. It's really common to experience these symptoms after a traumatic birth experience. It's your brain and your body's way of trying to make sense of and process and come to terms with what's happened. Things that could be helpful are talking to people about how you're feeling. Also talking to people about what's happened, if that feels okay. Writing about it or trying to process it in a creative way can be really helpful to do activities that help you connect back with your sense of identity, doing things that are important to you, that you enjoy. And also it's really difficult when you have a little baby because you're tired, you're not getting much sleep. But if you can, draw on your support network, try and get some rest, try and get some time to yourself, and just give yourself that time to heal.